Hello, welcome back. All of you in person. I know we have a lot of friends on Zoom right now, so thank you for joining us. Very excited to introduce this next section. Oh, I'm sorry. And for those of you that don't know me, I'm Lauren Zajac. I'm a pediatrician and the clinical director of environmental pediatrics here at Mount Sinai, and work with the NYSCHECK network in the Region 2 PACU. This next session, why I'm so excited to introduce it is because healthy homes and providing in-home environmental resources for families is such an important part of the care of the patients that I care for as part of an environmental asthma program. So along with Chris Bland, an asthma educator, we have a program where we work with children who have poorly controlled persistent asthma and provide them with asthma education, environmental resources, and importantly, connections to community-based resources that can help facilitate services that are so critically needed, such as integrated pest management, to address asthma triggers in their homes. And so this next session is going to showcase some stories of successful programs that are doing this important service for children and families. So this session, we have 3 wonderful hosts and then a panel of experts from different organizations who are going to share their stories. So this session will be hosted by the Asthma Dream Team. We have Lynley Siag from the New York State Department of Health, and Lynley is the program manager for the New York State Asthma Control Program. And she's accompanied by Shelby Ruppenthal, who also works with the New York State Asthma Control Program. And they are joined by Alexandra Kranidis, who is the co-chair of the New York State Children's Asthma Initiative and works with the American Lung Association. And so they're going to talk about different successes throughout New York State and also pull in some local experts such as Daouda from AIRnyc, who is going to share experience about how this happens on the ground and how they're able to connect families to these much needed services. So thank you very much.
Thanks so much, Lauren. That was a great introduction to this work that we're doing. Can everybody hear me okay? Okay. So we'll jump in and get started. The agenda for today, talk a little bit about where we've been, Healthy Homes pilot success stories and successes in New York City, housing remediation services, and then a little bit about where we're going. So again, I'm Lynley Siag with the Asthma Control Program at the New York State Department of Health. So thank you, Mehta, Lauren, and Perry, having us here today for Children's Environmental Health Day. And really, we're here to celebrate, right? And we want to take a moment to celebrate all of the progress that we've made, even though it seems slow at times. And this work is very challenging and requires so many strategic partners and so much collaboration across sectors. It can be complicated and even frustrating at times, but a huge thank you to everyone who continues to do this work and expand New York's access to home-based asthma services. So this is a quick kind of walk back in time. A decade ago, we were convening a call to action in-person meeting in Albany called Welcome Home. And this meeting brought together healthcare providers, health plans, health systems partners, community-based organizations. We held a CHW training the few days prior, as well as an Asthma Educator Institute for clinicians. And really the goal was to work on expanding home-based asthma services that are guidelines-based and supporting New York's workforce in doing these services. It's hard to believe that that is a decade ago now. And in the interim, we've had some publications from the Healthy Neighborhoods program that show that there is a return on investment for home-based asthma services and these types of even low-level interventions that can support a household. Asthma was prioritized under the Delivery System Reform Incentive Payment Program, or DSRIP, which I know many of you were involved with. There were multiple asthma projects, and the work that was done around asthma was identified as a promising practice. So that was really helpful as New York tried to continue to expand this support around home-based services. So also kind of towards the end of DSRIP, we were invited by the New York State Energy Research and Development Authority, NYSDOH, to initiate the New York State Healthy Homes pilot. So Alexandra will talk a lot more about that, and Daouda is here from one of our community-based partners, AIRnyc, to talk about a success story. And the pilot was a bit delayed because of the pandemic, but we finally got everything kind of up and running, and we're nearing completion of implementation for the pilot. And some of that work that we put into the pilot was really helpful in informing the current iteration of the 1115 Medicaid waiver, New York Health Equity Reform, referred to as NYHER. And so under NYHER, asthma remediation benefits are incorporated and available to Medicaid enrollees who indicate on a social determinants of health screener that they have challenges or issues related to their housing and environmental needs. So that work we're doing, the New York State Children's Asthma Initiative, we've been closely involved in NYHER and are at this point supporting the social care networks, the health system the health system partners in implementation of that, and working with CBO partners and delivery partners to operationalize that work. It's again, still challenging, but we're getting there. I wanted to share this publication from the National Center for Healthy Housing and RAMP, and New York is mentioned in that publication. It talks about some national examples of this work and how it's been progressing. So we continue to make progress, our determinations there. There's so many amazing programs that are taking place, like Lauren and Christopher's. A lot of programs here in the city. We'll hear about some of those, as well as other parts of the state. So certainly Rochester, a lot of work is taking place. Hudson Valley is doing a lot as well. Boston Children's Health Physicians, which was also a pilot partner. So we're just really thankful to all of our partners and excited to be here to celebrate successes. So I'll turn it over to Alexandra, and she can talk a little bit more about the New York State Healthy Homes pilot.
Thank you, Lynley. Good morning, everyone. So the New York State Healthy Homes Value-Based Payment Pilot, or as we refer to it as the pilot, is really a joint initiative of the New York State Energy Research and Development Authority, so NYSDOH, and the New York State Department of Health. The overarching goal of the pilot was really to support integration of healthy home interventions within Medicaid value-based payment arrangements. So households with at least one eligible New York State Medicaid member aged 0 to 21 living with persistent asthma that is not well controlled were engaged to receive combining energy efficiency services, weatherization measures, home-based asthma services, and education materials, including trigger reduction and other injury prevention measures. So the New York State Department of Health's Asthma Control Program convenes a cross-agency pilot team, including the Office of Health Insurance Programs and the Office of Public Health, to really identify and then engage managed care organizations and healthcare providers who serve those high-volume Medicaid enrolled children that had asthma in New York State. Pilot eligibility lists were generated by the participating managed care organizations. So those are folks like Health First, Health Plus, Emblem Health, Fidelis Care, and based on the clinical criteria that was indicated but for those individuals, if they had poorly controlled asthma, they were eligible for these services. So if you take a look at the map here on the left-hand side of the screen, these are the pilot service regions. And there are counties included here that are Western New York, Central New York, Hudson Valley, and New York City. The American Lung Association is the convener of the health services delivery partners. So those included and continue to include community-based organizations like AIRnyc, Catholic Charities of Buffalo, and healthcare providers like the Boston Children's Health Physicians in order to facilitate some of those pilot services. And the New York State Energy Research and Development Authority are the folks that provided the pilot funding. And they really work to identify the home improvement contractors and then to implement a lot of that work in the homes of these folks. So here are some of the services that were provided through the pilot. So they can be described across two categories. So those are the health services and then the energy and housing services. So as you can see here, those health services really involved things like asthma assessments to provide asthma self-management education to those families. The community health workers help to identify and manage home environmental asthma triggers in those homes using environmental assessments, and then provided additional education and information about risks that could be found in the patient's homes. The energy and housing services included dwelling, energy, and environmental assessments, installing energy efficient and weatherization improvements, as well as other environmental trigger remediations, and then other safety measures. So while the pilot implementation was a little bit of a longer road than we initially anticipated because of some of the delays due to COVID-19 and some of our other challenges, we are happy to share that as of the end of this August, we had 134 participating households that received pilot services, and that included home remediation services from a participating NYSDOH contractor. Over half of those households had an estimated project cost of $2,000 or less, largely due to some of the limitations regarding and around landlord consent. However, there were several higher cost projects that were completed, including 26 projects that were over $10,000 with an average cost of $24,000. So I want to take this moment to introduce a couple of additional folks on our team who are going to be sharing some of the pilot success stories that happened in the homes of some of our participants. So I'd like to introduce Daouda Diarrassouba, who is a senior community health worker with AIRnyc, and Shelby Ruppenthal, who is a health program administrator with the New York State Asthma Control Program. Shelby?
Thank you, Alexandra. I am Shelby Ruppenthal, Asthma Control Program at the State Department of Health. I will be reading a summary of a success story that was submitted by a former community health worker from Anthem Blue Cross Blue Shield. In March 2023, I contacted the member's parents and had a successful phone conversation with the mother. She was open to the Healthy Homes pilot and agreed to participate. She was interested in hearing and learning more about the condition that her child was newly diagnosed with and about the Healthy Homes pilot. We scheduled an in-person home visit. I went to the member's home and conducted a complete home assessment. Both mom and grandmother were present. Mom took out her child's medications and asthma action plan. She explained that the member had a couple of asthma attacks resulting in ER visits and that he uses his medicine daily. I educated both the mother and the grandma about asthma and management of triggers. I explained the Healthy Homes pilot and all it has to offer to the benefit of her child. The mother agreed to receive supportive products but denied NYSDOH services in the home. In April, I followed up with the mother. She confirmed that she received the asthma-friendly cleaning kit, including mop and water, thermometer. After a few follow-ups, I was able to convince mom of the value of NYSDOH benefits, and she agreed to these services. The NYSDOH implementation contractor visited the family and replaced a combo fire and carbon monoxide alarm, replaced all of the light bulbs to energy efficiency ones, changed the air purifier filter, placed safety bumpers in the bed and the dining room tables, steamed all area rugs, placed non-slip plastic rugs in the tubs, and provided the member with a humidifier. In August, I conducted a virtual assessment with the mother and member several weeks after the NYSDOH visit. The mother showed me all around the apartment, all of the rooms, and confirmed that replacements and fixes from NYSDOH were complete. The mother explained that the child is doing very well and only uses medications as needed or prior to doing any physical activity to prevent symptoms. No episodes of asthma attacks have been reported. She was pleased with the results and thanked me many times for assistance with the pilot services and the help offered in trying to keep her child healthy and her home clean and safe to avoid any asthma triggers. Thanks. I'll pass to Daouda.
Good morning again. Good morning, everyone. So my name is Daouda Diarrassouba. I'm a senior community health worker at NYC. So today I'm gonna talk to you about successful story of the patient that I've been working with. So so far, this is a 15 years old male residing in the Bronx community. So and the patient was identified as a high risk of health first and was referred to NYC. So then we enrolled the patient in 2022, right, to the New York State Pilot Healthy Home Program, which is a pilot. Then for 3 years, we provide a baseline assessment, follow-ups, and also we do some reassessment. And we were able to provide, some products to reduce trigger in their home. And the home repair were completed by NYSDOH. And in February last year, February 2022 or 24, so the ACT score was a 16. Then we started with the intervention. So during our intervention, right, the asthma symptoms start to improve after the program enrollment. Then we work closely with the family, right, to with the patient and the caregiver to provide asthma education on management and environmental triggers. And we were able to accomplish some care plan, so such as early warning sign of asthma exacerbation. We discussed difference between medication and educate the family on how to keep the apartment trigger-free. I also encourage this family, to use sealed plastic container to store food. And I also advise the family on home safety. And the patient and the caregiver, they were very, very, very responsive and open to learning. And the patient attend all these appointments, and caregiver actively work to reduce trigger based on, the service that, we were providing. And life today, after 3 years, as you can see, we have a lot of positive outcome. So I build trust through consistent and respectful follow-ups. And now the asthma is under control, no ER visit, no hospitalization since enrollment, and the patient will receive and train on use of asthma cleaning kits, asthma AAP, magnet, mattress cover, pillowcases cover. And then in September last month, during the last assessment, the patient ACT score was 25, which was amazing. And the patient completed the program. Then they want to continue with the care. So the care continuation will be like, they've already been to the last PCP appointment, that was in July. The next one is in December coming up, and they're gonna keep asthma under control to avoid ER visit or hospitalization or school absenteeism by managing the asthma triggers. And they're gonna stay connected to the care, and they will use resources that are available. So this was one of the successful story that I have from the patients. So, and that was amazing. Thanks again. Thank you. Okay.
Okay, so now we'll turn it over to the New York City Department of Health and Mental Hygiene. Tashari is not here. Great. Okay, so can we start with the Harlem Center Excellence. And I'm just going to quickly click through these. East Harlem Asthma Center of Excellence. The team, I'll let the team introduce themselves.
Good morning. My name is Lusta Phanord. I am the director of the Asthma Center of the Asthma Counselor Program within the East Harlem Asthma Center of Excellence. And today I'm going to be telling you a little bit about our ACP or Asthma Counselor Program, and to kind of set the stage for what Teresa is going to be talking about, which is our success story. Okay, so the East Harlem Asthma Center of Excellence is the heart of the asthma work that we do within our bureau. It is a place-based initiative that provides comprehensive asthma support to children and their families. It opened back in 2008 on East 110th Street between Lexington and 3rd, to help support families in that neighborhood. At the time that it opened, East Harlem had the highest rates of ED visits and hospitalizations among children ages 5 to 14 in New York City. And so we were the result of that. We opened to kind of address that issue and help bring those rates down. The flagship program within EHACE, within the East Harlem Asthma Center of Excellence, is the Asthma Counselor Program, or ACP. And this program is really a very, very comprehensive, multi-component, linguistically appropriate program for children aged 17 and younger with poorly controlled asthma and their families. And so this program incorporates a social work-based model of care. And what's wonderful about that, I think, is that it not only focuses on the asthma specific needs of the child, but really social needs of the entire family unit, needs that may, whether directly or indirectly, impact the family's capacity to support the child's asthma needs. And so sometimes that includes mental health issues, sometimes that includes immigration issues or interpersonal violence issues, et cetera. So whatever those issues are, they will be assessed and interventions will be put in place to help support that. And so the way the program works, each family that is referred gets assigned their own social worker. And most of our social workers, all but one, are licensed. And they will work with that family for up to a year to help support them around the child's asthma-related needs. There are two components of the program. There's a community-based component, and there's also a hospital-based component. With the hospital-based component, we have one social worker each assigned at Mount Sinai, and the other at Metropolitan Hospital. And the social workers kind of do the recruitment and all of the supportive work directly with the families at their assigned hospital. And then with our community-based component, the recruitment and all of the work happens at EHACE, right? And the social workers are housed and based at our building at EHACE. And so as part of the support and the work that the families get, there's a lot of asthma education. That happens not just with the child, but with the entire family. There's a lot of case management work, a lot of medication management that happens. And then once their needs are assessed, they get the appropriate referrals if it's something that we cannot handle in-house, right? And so in addition to that, they get a lot of events that happened within our program that help bring families together so that they don't feel as isolated, but it also helps support them and address whatever needs we identified. So one of our most popular events that we have is a back to school event that we have every August where the children get backpacks full of school supplies and so forth. We also have a holiday event every December. So they're getting holiday gifts and toys. They're having a whole party. They take pictures with Santa. So all sorts of things. We do food distribution events for them because food insecurity is sort of a major concern as well among our families. So we identify all of those needs and we provide supports around them. Okay, so our program, of course, we continuously sort of assess the work that we do to get a feel for, all right, how effective is it, the work that we're doing, and what can we do to further improve it? And so this is part of it was published in the Journal of Asthma, I think in 2022, if I'm not mistaken, sort of the outcome of our program. And what we found is that after having participated in our program, the families actually had decreased ED visits, decreased hospitalizations, decreased prednisone use, decreased school absences, and so forth. So all of the work that we're putting in and all of the work that the asthma counselors are doing are having and making an impact, which is wonderful and which is what we like to see. All right, so I mentioned that we like to sort of conduct ongoing assessments to get a sense of how the work that we're doing is impacting the families that we're serving or what needs they have that we can address. So one of this slide here reflects sort of an assessment of children that were enrolled in our program for our 2025 fiscal year. So it was from July 1, 2024 through June 30th, 2025. And the idea was to kind of get a sense of what were their identified barriers. And the majority of them had housing quality issues, right? Issues around housing quality, unemployment was a big one, language barriers, immigration, and so forth. So there are a lot of barriers that they come to us with that we sort of have to the extent that we can, support them in addressing. And one of the things that we do is we provide resources and supplies to our families to, again, help address some of the barriers that they experience. And so this is just showing some of the supplies and resources that we distribute as part of our program. And so our families receive air purifiers, they receive pillowcase and mattress covers, of course, a lot of asthma literature, cleaning supplies, right? We provide them with a lot of green cleaning supplies because we don't want them using supplies that can potentially trigger asthma exacerbations. We give them sealed containers that cockroaches and mice can't get into. But one of the biggest sort of interventions internally that we provide is around IPM, integrated pest management. And so within our program, we have integrated pest management services for our families. We contract with an external vendor and we refer families out to that vendor to receive the IPM support. The one thing about the IPM service that we provide that's sort of slightly different from ACP is that whether they're part of ACP or not, as long as there's a child in the home that has an asthma diagnosis and the child is 17 years or younger, they can receive IPM service. So internally, if they're enrolled in ACP, they're automatically going to be assessed for and receive that service if they need it. But we can get external referrals from people in Queens or Staten Island or wherever else, and they would also receive that service whether or not they're enrolled in ACP. All right, so I'm going to stop here because this was just kind of me giving you sort of the general context of the work that we do, and then I'm going to pass it on to my colleague, Teresa, who's going to kind of highlight one of our success stories. You're welcome.
Good morning, everyone. I'm Teresa Martinez, and I'm the program manager at the Asthma Counselor Program. I'm going to be a little bit repetitive, but I hope that you will bear with me. The Asthma Counselor Program is staffed by master's level social workers who are trained in providing client-centered holistic care. Our approach to service delivery considers the biological, psychological, and social factors that influence our clients' asthma diagnosis, their ability to manage symptoms, and their overall well-being. When working with clients and their families, we take into account not only the challenges they face, but also their strength, their agency, and their resilience. This perspective informs our case management and ensures that our support is both empowering and comprehensive. In addition to providing in-depth education on asthma triggers, medication use, and symptom management, we connect clients to essential resources, as Lusta indicated a little while ago. These include integrated pest management services, medical and mental health care providers, and asthma-related supplies to help improve health outcomes. So now I'd like to briefly talk about one of our success stories. This is a 4-year-old boy who was referred to us by Metropolitan Hospital after a hospitalization. I completed the initial assessment with the family, and mom came in and she said, well, you know, the doctors say that my son has asthma, but I don't know how that could be possible because I don't have asthma. My husband doesn't have asthma. Our grandparents don't have asthma. Our great-grandparents did have asthma. Our third, fourth cousin did have asthma. So how is this possible, right? And so I explained to her, yeah, I can see why you may not feel that your child has asthma. But let's talk about what asthma is, and let's talk about why a child can have asthma, even though you and your great-grandmother and your third cousin on your fourth side doesn't have asthma, as well. And so we talked about environmental triggers and the impact that that can have on anyone, right? Even if your relatives don't have asthma. And so we also talked about medication and how to use medication, how to comply with medication, what each medication did. And so we ended that initial assessment, and then I called her in 3 months to follow up and do a second assessment. And she said to me, well, he's been coughing. And I said, oh, okay. And what'd you do? And she said, well, I took him to the doctor, right? And I said, and what did the doctor say? Oh, he said he has asthma again. And I was like, pesky doctor. And I said, so what'd you do? And she says, well, I gave him the jarabes. And jarabes is the Spanish word for any kind of serum. She said, I gave him the jarabes that my grandmother used to give me. That's what really works. And so I said, well, how did that work out for him? She said, he's still coughing. I said, you know why? Because it's asthma. Let's talk a little bit more about the symptom of coughing. the fact that coughing, although when we think about asthma, we think about the wheezing, right? That's what most people think about, the wheezing. They associate the albuterol, but coughing is a trigger. And let's talk about why that is. Let's talk about the mucus that is formed in our lungs. And let's talk about how your body is trying to expel that mucus, right? And so I went in depth about that. And then I said, I'm going to send you some literature just in case you're still not convinced that the doctor or I know what we're talking about. I'm going to send you some literature about coughing and asthma in children. And I want you to read it, and we're going to talk about it the next time that I give you a call. And she said, fine. And I sent off the literature. And along the way, she started to believe us. She started to believe that, you know, the doctor and myself, we knew what we were talking about, and that this coughing was actually a symptom of asthma and that it wasn't going to be resolved just by providing the Arcila. One of the other things that we provided was IPM service, the integrated pest management, because she did indicate that she had mice, cockroaches, which are not uncommon in New York City, molds and peeling paint in the home. And then during another assessment, she talked about the fact that she had discovered another trigger which was amazing, because after not believing that her child had asthma for felt like 3 to 4 months, she says, you know what? I've discovered that when he plays, he coughs. And I said, wow, Mom, that is awesome. I said, what you should do is take him to another doctor's appointment. I said, but what a lot of doctors are going to tell you, and what they say, is that 30 minutes before playing, he should use his rescue inhaler. And so she started doing that, because now, you know, like I said, she kind of trusted me and she believed what I said. And so she started giving him the rescue inhaler 30 minutes before his playing. And so that definitely helped to improve his symptoms. And she began to really trust the asthma counselor program, trust that we were going to provide her with accurate information, and that if she followed through, that he was going to have less symptoms. And along the way, she revealed to us that she was having some really harsh legal problems. She was her housing was unstable because her landlord was taking her to court, stating that she had not paid rent. I think he was really just trying to get her out of the house because he wanted to increase the rent, which is unfortunately not uncommon here in New York City. And so he took the family to court. The family consists of the mother, the father, the older brother, and my client, the 4-year-old child. And she was able to prove that she's been indeed paying rent. He started a holdover eviction. And needless to say, Mom was experiencing lots of symptoms of depression, hopelessness, and was having a difficult time parenting. And we know that emotions also trigger asthma symptoms, right? And we also know that in a 4-year-old child who's watching Mom cry, who's watching Mom be stressed out, that was also going to trigger asthma symptoms. So I got to work right away, and I referred her to a legal agency here in New York. And thank God that they were able to take her, because these legal agencies are really, really busy. But they were able to get her an attorney, represent her in court, get her also an immigration lawyer. I was able to advocate for that. And what has happened now is that Mom feels a lot more hopeful. Her son has not had any coughing in weeks. We have not heard about the jarabe since that conversation. You know, she put the jarabe away, and she's pulled out his Flovent and his albuterol, and that is what she's using. And she automatically, when she knows that he's going to have a rough and tumble day, she pulls out the medication and she says, no symptoms. And I said, that is amazing. And she's feeling better. Her entire family is feeling supported. And although they're still having issues with housing, they feel hopeful. They feel that they have people on their side. And what's most important is that my 4-year-old client is feeling healthy. He's feeling better adjusted, because he's watching his parents be happier and less stressful, just in time for him to start school. So he's going to school. He's going to rock it out. He's going to play at lunchtime, and he's not going to have asthma symptoms. Winning.
So thank you, everyone. Thank you. All right.
Any questions? Okay, thank you.
Okay, you ready? We'll go back now. Okay, Tashari?
Since I'm up here by myself, I'm gonna take my mask off, but I apologize. I'm very much under the weather. I have a toddler who started school for the first time this year. And so, all the diseases are happening. This is viral and not contagious anymore, but still, I'll wear the mask. So, hi, my name is Tashari Grant. I am from the New York City Department of Health Healthy Homes Program. Within that, the Healthy Homes Program, we are sponsored by the state, and we have a grant called the Healthy Neighborhoods Program, which also assists in our work here. But I'm primarily going to be talking about the pest and mold enforcement work that we do for tenants with persistent asthma. So to be clear, the Healthy Homes Program encompasses both a division that does lead poisoning prevention work in the homes of children with elevated blood lead levels. And my unit, which is also known as the Healthy Neighborhoods Program, does work in the homes of tenants. So that means both adults and children who have been diagnosed with moderate to severe persistent asthma and are reporting that they have pest and mold in their home. In addition, Healthy Homes Program will also respond to unsafe work practices complaints in homes where children are younger than 18 years old. This is largely to identify lead issues that may lead to lead poisoning. And then as a part of our work, both programs will refer to other programs such as early intervention, the housing agency for window guards and other areas of housing maintenance that we do not have jurisdiction over. We also provide education and outreach. Some of what is provided by the New York State H&P program. We used to buy mattress covers. We used to buy air valves. We used to buy these night totes, as well as Rubbermaid cereal containers for rodent proofing the home, things like that. So the enforcement arm of our program in relation to pest and mold is Local Law 55 of 2018. It's also known as the Indoor Allergen Law, and it is a requirement that private residential building owners with 3 or more units and property owners of housing units where a tenant has asthma are required to keep their homes free of rodents. So that's mice and rats, cockroaches, and mold. So it also requires a form of integrated pest management, but when in relation to mold, it is really just preventative approach to maintenance. In essence, fixing holes, fixing leaks, things like that. And then also it requires that when they're doing that type of work, they should be using safe methods. So that is primarily containment, making sure that you're not affecting the other areas in the home, because again, in New York City, it often isn't, you are not able to move the tenant out of the home in order to do this type of work. There's not enough space, there's not enough anything. So there is ways to do the work safely, and that is what the local law 55 is telling them to do. So there are two agencies, city agencies that enforce local law 55. So that is the health department. And that means that we are responding to referrals from providers that are saying that an adult or a child has a diagnosed asthma condition in the home. That means that we are going out to all properties, including temporary, AKA shelters, or public housing, as we affectionately call it, NYSHA, New York City Housing Authority. And as well as co-ops and condos. Co-ops and condos are tricky. They are covered by local law 55, especially if the tenant is not the owner of the co-op or condo. So people rent their co-ops and condos often, and that is when come in. But also, even if they are the owner of a co-op and condo, mold is primarily where it becomes a sharing often based on the bylaws. So I just say that because that is something that is different from what the other agency in New York City Housing Preservation and Development, also known as HPD, or it is the housing agency in New York City. They respond to 311 complaints of pest or mold, regardless of health condition. That is not what they are there for. They don't need to know the tenant's health condition, but it is for private housing only. So that is people who, so it's not NYSHA and it's not going to be shelters. So what is a health inspector looking for when they go into the homes? They're looking for evidence of pest. That includes frass, AKA poop, roach poop. They're looking for rodent runways, which is, I don't know if it's almost lunchtime, but anyway, they're greasy, they're very oily creatures, and so they leave trails, especially on well-traveled spaces. They are creatures of habit, just think of it that way. So we're also looking for visible mold, right? We do not do air sampling. We do not do swabs. This is largely because there is no permissible exposure limits for air and mold, for air samples and spores, right? So that's largely because mold is ubiquitous. It is all around us. It will exist. But what I need to do, what this law is saying, I need to figure out how the landlord is responsible, right? So that is why we do not take those, because we can take them, but what do they mean? What can we do with them? So we're looking for underlying conditions, as I mentioned before. We're looking for window guards because all inspectors will look for window guards. That is one of the pinnacles of public health. It has saved so many lives. So window guards are important. Peeling paint, we're also looking for that largely because we do referrals for them. Functioning smoke and carbon monoxide detectors, which we will also provide to the tenant if they do not have one. And then we have a plethora, again, of educational resources that we're also providing to the tenant. So if hazards are found, what do we do about it? So a private property owner is a little bit more straightforward in the sense that we have enforcement capabilities against them. We can order them to do it. So what we do is we send them what's called a commissioner's order to abate, stating so in essence, we're putting them on notice that you have these conditions in a property you own, and you have 21 days to start addressing these issues, right? So that is, we're giving them a time to cure in legal terms. So they may, if If they can show reasons why they aren't able to finish the work within the time allotted by the commissioner's order, we then may grant them additional time in order to close, because again, we're in public health. We are more interested in the issues getting addressed than being punitive. That is not our mission. That's not my mission. So but if the issues are not fixed, meaning they did nothing within the 21 days upon health department follow-up, we may issue a violation. That is what a violation means, that we will then send, we would send them to the Office of Administrative Trials and Hearings, and a third party will determine if we have enough evidence to say that they are in violation of our commissioner's order, and if so, then they'll issue a fine to them. Our fines are sometimes nominal, in my opinion, but it sometimes is effective. But in forcing them to do the work, or at least letting them know we take us more seriously. We will also respond to tenant complaints of ordered work that we did. So if we ordered the owner to do the work, we will respond to complaints that they're not doing it safely. We have done that, and we have also issued additional violations when that happens. We also will put in complaints for unsafe work practices as well, because often the properties that we see have lead conditions. All right, so I think the biggest success story is that this gave legal teeth where there was none before. Local Law 55 is not perfect. I will wholeheartedly admit that. There are areas that are ambiguous, but it gave teeth where we didn't have any before. We have been, the Healthy Homes Program has been working in this space since 2014. And some of it was a hope and a prayer to get them to do it. It was very, like, being very a pest. This allows us to tie law to what we're saying that they should be doing. So it has been effective in that way, but it also fosters both interagency and intra-agency collaboration. Even though it's called Local Law 55 of 2018, it wasn't actually enacted until 2019. So that's why I said since its introduction in 2019. So a part of Local Law 55 is that it allowed a memorandum of understanding between us and New York City Housing Preservation and Development, HPD. HPDs, because they're a housing maintenance program, they're huge. They have access to vendors that the health department does not have access to. So they have contracts as well, especially since they are also a co-enforcer of the law. So if the owner does not do, remember when I said we'll issue a violation, in addition to issuing the violation, we are able to ask HPD to go in and send their vendor to do the work. This is a long process. It's not quick, but it is something. And often HPD will usually find other issues with the building that, because a lot of our work is unit-based. All of our work is unit-based. So they can also find other issues with the building because we're not housing that they can cite. Especially since, particularly for rats in particular, it's usually a structural problem with the building. So having HPD on our side with that, going in, having someone do the work and also citing other issues is very, very, is a huge success in my book. In addition, we have, so we can't necessarily do enforcement work with NYSCHECK and DHS and all, but it has fostered collaboration where there wasn't. So they do it though. It does require maybe a little bit more hand-holding than with our private owners, but we often do joint inspections with both the pest management unit within NYSCHECK as well as with DHS. And they will actually, follow what the inspector is looking at. These are long inspections. Sometimes they're numerous. And often they do a lot of out of scope things that are actually not in our order. So for instance, we do cite when tiles are broken in more than one development. Those are often asbestos tiles. I don't necessarily have jurisdiction in order for them to address that. However, they address it. So, and in those instances, they often move the tenant out to do the work. All of those instances, they move the tenant out to do the work. But that might mean it takes a year in order for the tenant to get the work done and back in their place from start to finish. Could take longer. We have had those instances, especially when it's a large family that might have a 5-unit or more. It may take longer. There's not that many 5-unit apartments in New York City or in NYSCHECK. So it takes time, but we get it done. And then also we have partnered, Teresa, I have to answer an email for you. We have partnered with Bronx IPM program in East Harlem Asthma Center of Excellence, largely because even if HPD does the work, EHACE does amazing work. Their vendors are great. We have always had a lot of our tenants love them. So especially if there's a child, when there's a child, we'll ask them to go in, especially if there may be things like, for instance, the case that I was emailing about, the tenant's housekeeping is not great. And although the vendor from HPD vacuumed, and we would like another treatment. So it's great partnership, and it's provided collaboration where we didn't always have it. And in my ideal work, we would have both enforcement and independent, because have our own independent vendor, largely because I like to tell the vendors what to do. And our scope, they can use our scope. It's not me being bossy, but it's because we don't have as much control when we have the owners doing the work. And I like control. So, I think that's it for me. There was another screen for resources, but it's not advancing.
Oh, yeah, it's not going. Okay. Okay, that's okay. We're going to wrap up. Can I try to? Oh, there we go. All right, resources. Okay, so we're going to wrap up and take you through, where we're going now after hearing all of these success stories. So the New York State Department of Health Office of Insurance Programs has received the Center for Medicare and Medicaid Services. It's the next iteration of New York's 1115 waiver amendment, which is referred to as NYHER. It is effective through 2027, and this is to fund healthcare reform innovations, including a program of social care networks, or SCNs, which is really our area of focus. So in the interest of time, I'm going to skip through a few of these, but I do want to mention that on the New York State Children's Asthma Initiative website, we have lots of information about the NYHER waiver, information about asthma remediation services. You can click through and see information about resources, trainings that we offer, environmental assessments, asthma assessments. There's lots of information for those who are looking to partner with the social care networks as well. So again, the New York State Children's Asthma Initiative website has an entire NYHER page that you're welcome to take a look at. What we do encourage you to do today is to really reach out to your regional social care network lead entity for information about how to participate in the waiver, including how to join the network itself, and then how to support your Medicaid members through screening and enrollment, specifically in asthma remediation, but also to connect them to some of the other HRSN benefits. And again, up on our website, you can see there's a list of the social care networks as well as the links to their individual web pages. They are by region, so they're listed here, but again, you can see some more of that information up on our website. And then finally, we don't have time for questions today, but we did want to let you all know that the New York State Children's Asthma Initiative will be hosting a home-based asthma services training in December. So if you or someone from your organization is interested in participating in that training, it is free and it is hosted and facilitated by our certified asthma educators. So if you're interested in that, feel free to reach out to any one of us today and we'll connect you to the appropriate folks. But you can also register from the New York State Children's Asthma Initiative website as well. And then just a quick plug for our Instagram. If you're on Instagram, give us a follow at the New York State Children's Asthma Initiative page there. We continue to host and show lots of the webinars that we facilitate, training opportunities, and then links to additional resources. Thank you very much.
Thank you again for a great and inspirational session. And I just wanted to say, as a healthcare provider, how grateful I am to be able to refer to programs that you all administer. It truly makes a difference in the lives of patients and families. So thank you again from the bottom of my heart. Thank you. We are going to move on to the next item in the agenda. We have a fun award ceremony. Maida.
Thank you. That was so inspiring, Tashari. I think you gave me some ideas for a roadmap for research to action. It starts with hope and a prayer, and then it moves on to labor of love. And then systems change, policy change, and healthy communities and healthy families. And I think we should call that the Tashari roadmap. It's sort of a roadmap for our field. I'm gonna pull up some slides. Over here. There we go. All right. So one of the reasons we're so excited to be together again is while we've been doing annual grand rounds for Children's Environmental Health Day and informal gatherings, this is the first time since COVID we're back in person for a more public facing event. And so we are so grateful to all of you for being with us here today. We know each one of you are champions for healthy environments. And so this is our award celebration. We thought this year was especially important to champion the work that you all are doing. This is our schedule for today, and we're going to just jump right in. We have art awards. Sarah Evans is going to share about the Summer Academy. We have our Children's Environmental Health Champions Award. We have a brief panel discussion. And then we want to have the opportunity for all of you to meet each other because there are experts in this room on a variety of topics. As we end this session, we hope the conversations that start here continue into lunch and into the afternoon tours, and then to future collaborations. And so with that, I will turn it over to Dr. Chase Moon.
Thanks, Maida. For everyone who doesn't know me, my name is Chase Moon. I'm a pediatrician and I'm completing an environmental health fellowship here in the Region 2 PACU and with the NYSCHECK centers. So I've had the pleasure over the last few months of working with Dr. Cappy Collins as well as John Culhane to help run our annual Envisioning the Environment Youth Art Contest and Showcase, which is a partnership between NYSCHECK, the PACU, as well as the New York State American Academy of Pediatrics. And we have a collaboration going as well with the San Diego Pediatricians for Clean Air, who also do art contests every year. So what we asked for New York youth to do this year was create original artwork that captures their vision in one of two categories, either healthy communities, asking them what they think homes, neighborhoods, and places that are healthy for New Yorkers look like, and also in the category of fast fashion, which is an environmental health issue, very pertinent in today's age. So asking them to talk to us or, demonstrate through artistic skill problems as well as solutions around the production and disposal of clothing that contributes to climate change and pollution. We had 36 entries this year, which is the most I think we've had ever. So we're very excited about that. We have some of the artwork here as well in person today, so I invite you to come up and take a look. Every artist is going to receive a certificate from our program, but we also had a wonderful donor donate some money. So I'm going to walk you through some of the top entries. We had a tough judging on Tuesday, figuring out our top winners, and those winners will receive a $100 Amazon gift card as well. So hopefully we're hoping they'll take that back and either celebrate or buy some more art supplies and continue with their work. So without further ado, we'll start talking about some of the artwork. I also want to say that the other entries, we were showing a slideshow during the last break, and during lunch, we'll be running that again so you can see all of the artworks. So as you can see here on the left, this is one of our fast fashion winners, Alexandra, who's a Long Island High School student. A very interesting display in the ocean with all the fast fashion pollution that's going on. And then on the right, you can see Jory, one of our 10-year-old New York City school students. This was a Healthy Communities entry, and she was focusing on heat islands and building solutions for parks and playgrounds, which is what the trees, and this center here is actually like a solar installation to help capture some of the sun. We have artwork here from Mamadou as well as Josiah, who are two New York City school students. Mamadou focused on getting rid of air pollution. And over here, this is actually a robot solution. One arm says a wing to stop plastic and an arm to pick up trash, which we really enjoyed. This over here, this is Aaron, an 8-year-old New York City school student. I'm sorry I can't share the whole story with you, but there is an epic story associated with this one, including an escape to Canada. I'm here, I'm waiting for the TV adaptation as well as a sequel. And then we also have Addison here on the who's 12, who's also a New York City 6th grade student. Both of these, well, this was a Healthy Communities fast fashion, and this is fast fashion as well over here on the right. We also had Alston, a 7-year-old from New York City. This is all about cutting down trees that are then producing energy and producing air pollution that affects our schools and our homes. And Abigail here, another 8-year-old New York City school student, did a fast fashion entry. And this is at the beach. And you can see all of the clothing that's in the oceans as well. Last but not least, as you can see, we also have it on display here, is this diorama from Luna, who's a 9-year-old New York City school student as well. Not only is it focusing on fast fashion, but there's some great risk communication framework up here about steps that you can take to reduce fast fashion as well. So with that, I will say congratulations to all of our art winners. They don't know they've won yet, so we'll be sending out emails the end of this week with the gift cards as well as certificates. And with that, let's see. And then this is our last category, Little Sisters of the Assumption, which is a community group we work with. They do a summer enrichment program. This is all of the artwork that they've submitted. They submit every year, so we'll be giving them a gift card as well so that they can have a whole celebration. With that, I will pass it over to Dr. Sarah Evans. Thank you.
Thank you, Chase. That was really amazing and inspiring. And so building on, I'm Sarah Evans. I'm an assistant professor here at Mount Sinai in environmental medicine, and I work with the NYSCHECK team, and I'm one of the co-directors of a program that we're really proud of, our NYSCHECK Summer Academy. And so we just wanted to take a moment today to celebrate this program and acknowledge the work of all of our directors from across the state, as well as the state agencies and community partners who have contributed to this program across 5 years. We've trained 200 students at the high school, college, graduate, and medical school level. And so we reached out to some of our alumni students, and we asked them to share with us a little bit about how the program has impacted their career trajectory. And so just to give you a little bit more context for the program, it's an 8-week virtual program. We train students in foundations in public and environmental health, leveraging our incredible network, as I said, of faculty and partners across the state. And we give the students an opportunity to come up with solutions. So we're really training future leaders who will continue the work that, some of the work that's been shared with you already today. And when we talk to these students, we hear that we've increased their knowledge and capacity around these issues. And importantly, they feel more empowered to make change in their community. And so I want to acknowledge this video was created by some of our team members, John Colhane and Melanie Gabrell. So we're very grateful to their contributions. And I will just let the students speak for themselves.
MD student in my first year in Miami.
Second year MD student at New York Medical College.
Junior at Huntington High School. First year medical student at Toro College of Osteopathic Medicine.
Master student at Georgetown, where I'm studying global infectious diseases.
I'm currently a junior-based college, majoring in biology and minoring in chemistry.
Thanks to the passion for environmental health that NYSCHECK really ignited.
Now I think about becoming a proactive physician who addresses upstream challenges.
Start from the root of the problem. So when we do find a solution, that solution is long-term, not short-term.
It's really opened my eyes and allowed me to look at different situations using different perspectives.
Taught me how to work in diverse environments, while also learning how to utilize each person's strength.
Healthcare is all about collaboration, and I really enjoyed collaborating with the other students who will be my future colleagues.
The mentorship that I gained throughout the program has been deeply influential.
I hope to incorporate everything that I learned in the NYSCHECK Summer Academy into my career as a pediatrician.
Okay, and that's all. Thank you very much.
Thank you, Sarah. And yes, thank you, John and Mel, for putting that together, and the students who obviously contributed their testimonials as well. So for those of you who didn't hear us introduce ourselves this morning, I'm Perry Sheffield. Mehta, I guess you already introduced yourself. We had the pleasure this morning of giving the first surprise award to Dr. Alan Woolf, who gave the pediatric grand rounds this morning. He's with us today from Boston Children's Hospital, and our correlate PACU co-director based up there. For those of you who don't know, we direct the Region 2 PACU, or Pediatric Environmental Health Specialty Unit, based here at Sinai. And so, Alan, you were our academic awardee today, but we also have some other categories of awards. And so our first state government award goes to, let's see, this was Alan, yes. Oops, no, we're gonna do that. Okay, goes to Michele Herdt. And so let's see, what do we think? Do you want to have people come down. Michele, if you'll come down and join us at the front. Michele Herdt is the director of the New York State School Environmental Health Program within the Center for Environmental Health at the State DOH. And she is the program manager for the New York State School Lead and Drinking Water Program and our NYSCHECK, New York State Children's Environmental Health Center. We are grateful for that, and it's going on a number of years, so we've had the pleasure of working with you. She's also faculty in the Department of Epidemiology and Biostatistics at the University of Albany, and we are honored to present this award to you.
Our second state government honoree is Lynley Siag, who serves as the program manager for the New York State Asthma Control Program at the New York State Department of Health. When we first let her know about this award, she kept saying, no, don't give it to me, give it to this person and this person and this person. And so we will listen to you, Lynley, for future years, but this year, we're honoring you. Since 2015, she has led the New York State Asthma Control Program efforts to engage multi-sector partners in expanding guidelines-based asthma care, coordinated across clinical, school, home, and community settings. This is not an easy task. Lynley, you make it look easy. She oversees evidence-based strategies and interventions advanced under the New York State Children's Asthma Initiative, a collaboration with the American Lung Association to improve asthma-related health outcomes and quality of life for children and families. She holds a Master's of Public Health from the University of Albany and Master's of Public Administration from Syracuse University, and she shares this award with all the panelists that joined her today. Yeah. All right. And next we have an award from someone who has spent her career at the federal government level. Ameesha Mehta-Sampath is an internationally recognized public health scientist and strategic leader with more than 35 years of service at the US EPA. She's built a career defined by innovation, collaboration, and results, dedicating her life to advancing environmental justice, children's environmental health, climate adaptation, and disaster recovery, and earning a reputation for turning science into action that improves lives. She led high-impact programs that reduced asthma among school children, pioneered recovery initiatives in Puerto Rico and the Virgin Islands after devastating hurricanes, and championed community-driven strategies to address lead, mold, air quality hazards, and more. As Senior Policy Advisor on Cumulative Impacts in EPA's Office of Environmental Justice and External Civil Rights, she guided multidisciplinary teams developing regional frameworks, geospatial tools, and participatory science models to tackle environmental disparities. Recognized for coalition building across government, academia, philanthropy, and communities, she's trained and inspired hundreds of professionals, strengthening environmental health capacity worldwide. She has a plan for each of you in the room today. If you talk to her, she will move us towards action. So she's also mentored high school students, college students, graduate students, fostering the next generation of leaders. She received the EPA Gold Medal and Bronze Medals, and underscoring the extraordinary breadth and impact of her contributions. And for that, we thank you.
And Lauren. And Lauren's going to come present, and Lauren and Chris are going to come introduce themselves and present their last award.
Hi, everyone. Good morning. I'm Christopher Bland. I'm a program coordinator and asthma educator for our NYSCHECK and PACE organizations at Mount Sinai. And I work primarily on our Team Kids Environmental Asthma program led by Dr. Zajac, which we are really happy to announce our next awardees. And so the last three awardees today represents a community partner who is essential to our work, connecting families to environmental health resources. And they've been with our program since day one. And we would love to award awarded to AIRnyc, specifically their community health worker program. Please come up. AIRnyc is a community organization whose mission is to fight chronic diseases by breaking down barriers to care, while also giving to their clients a voice in how change is achieved. Today, we honor them and their three key staff members. Daouda, Diarrassouba, who presented last session, is the logistics manager and senior community health worker with AIRnyc. He now serves as the lead CHW for the SOMOS 1115 waiver program in the Bronx. A native of Cote d'Ivoire and now with 20 years of community health experience, he's worked as a community organizer before immigrating to the United States in 1993. Jennifer Arcila, also a community health worker, joined AIRnyc in 2022 as a community outreach intern and returned in 2023 after graduating college. She also drives AIRnyc's Food as Medicine initiative in partnership with the Sun River Health and supports the implementation of the Medicaid 1115 waiver in Queens, Brooklyn, and Manhattan. Born in Colombia and immigrating to the United States in 2019, Jennifer brings a strong public health background and a commitment to equity. Yelissa Alvarez is the third community health worker representing AIRnyc today. She also joined AIRnyc 2022 and is a go-to CHW for asthma and respiratory care. She now serves as the lead CHW for AIRnyc's 1115 waiver work on Staten Island. Dependable and outcomes-driven, Yelissa jumps in wherever she's needed across programs. She maintains her annual American Lung Association certification and has completed multiple patient-centered care trainings. Originally from the Dominican Republic, she moved to New York City in 2017. We are really grateful for able to refer our patients to this team. They've done amazing work, a really high engagement rate, and we just hear nothing but great and positive things. It's been a joy to work with you guys over the last year. You always bring positive energy. We're really excited to always meet with you when we can. And thank you for the wonderful work you do for our patients. Yes. And we're really proud to present the Children's Environmental Health Champion Award to you and your team. Thank you.
Thank you.
Okay, so the next portion is we're going to have a brief opportunity to hear from our awardees. And if the awardees would come stand up at the front of the room, we have a mic. Yeah. All right. All right, for this first question, we'll go down the line. What children's environmental health issue are you passionate about?
The one issue that I'm really passionate about is addressing asthma disparities, but looking at it from a holistic viewpoint, a cumulative impacts viewpoint. Thank you.
Hello, I'm Michele, and my children's environmental health passion is school environmental health.
My passion is like their support, change life and children. That is the main reason for this.
What I'm passionate about is that when educate families about children, they have the basic thing that they need to take care of, to improve the kids' house, kids' life in their home.
Hi, this is Jennifer. So my passion is close the gap in care for asthma patients, for children, and connect them to the resources they need.
Hi, Lynley. You already know mine. It's supporting
healthy homes for children and their families.
I'm Alan, and one of my passions is water, safe drinking water, but I think also passionate about what the others have talked about here in terms of the social determinants of health. And when you go into a home for lead exposure, or you go in a home for mold exposure, that's when you find out these families are dealing with unemployment. They're dealing with other contributors to their stress levels and getting overwhelmed. And that's what I heard this morning, and it's really inspiring to hear that you take a holistic view of this and address those social determinants of health that make such a difference.
Thank you. The next question is, we don't have to go through down the line. If anybody's interested in sharing a story about a children's environmental health win or a success story, and we heard a number this morning from you, Dr. Woolf. So if anybody spends time on Cape Cod as you're taking a glass of water, you can say thank you, Dr. Woolf. But we open it up to the floor for anybody who would like to share a win.
Yeah, so when I come from EPA headquarters to the region, which was around 2001, I was asked by our regional administrator at the time, Ameesha, you need to address the asthma epidemic in Puerto Rico. And at that time, there was a Veterans Administration study that showed that school children, public school children in Puerto Rico were seeing an asthma rate of 45%. And many, many children were dying, more so than on the mainland. And after building the asthma partners over time, ensuring that they have the capacity and the wherewithal to apply successfully for EPA grants, and working with my other federal partners like CDC, HUD, etc., as well as the territorial agencies, over decades now, the asthma rate is 14%, which is still high, but it's a significant success. And to address and to look at it in a way where the families have the information that they need to understand what the triggers are and to reduce the triggers. And so I think one of the best examples that I've had on what it takes to work with communities in a consistent manner, ensuring that there's consistent funding available for them, then magic can happen. Thank you.
I'd just like to share that I, in the last year, got a large EPA grant that helped me to build on a previous smaller EPA grant. So in the first 9 months of my new grant, we've been able to educate almost 1,400 schools on indoor air quality, water quality, mold and moisture, and many other school environmental health issues that come up. And together, those schools educate almost 800,000 children that could benefit from the knowledge that their leaders are getting. So we're super happy about that. And just also a little shout out to our School Lead and Drinking Water program, which is a leading program in the nation that we are testing every public school in the state for lead and getting the drinking water reduced to less than 5 parts per billion. So.
Yeah, so I want to share this story with you guys. So this happened a couple of years ago. A boy that I was working with, I was working with the family from West Africa also, and the child was at school. He was experiencing asthma symptoms. Then he went to the nurse and everything. They called his mom. Then when they called his mom, he told his mom that call Daouda. So when he said call Daouda, mom called me and told me that okay, the child is looking for you because he's having asthma. So since then I realized that I'm really making some change in people's life. So from that age, be like, oh, we have to take this seriously. The little thing that we're doing is impacting the community. So we have to keep doing it, and we have to trust of what we're doing and keep going.
Just one quick one. Back in COVID in 2020, 2021, we really missed opportunities to screen kids and test them for lead exposure. And it's estimated we lost maybe in New Hampshire a third of 1 and 2 year olds who should have been tested and were not. And since that time, we've done some health professional outreach in New Hampshire and offered some seminars and worked with individual practices, community health centers, and we're back up to about 75% of the eligible 1 and 2 year olds are now tested for lead. So much improvement.
Amazing. Thank you. And our final question is, what's one action that you recommend we take to advance children's environmental health?
I would say that for every environmental decision, whether it's at the state, federal is an interesting place. So let's keep it there. But at a state level, we should incorporate children's health impact assessments right up front, not as an afterthought.
I can also recommend to keep awareness what is going on, what is the problem, and also provide education, what we can provide a solution to this problem.
Like she said, awareness is very important, and as you can see today, secondhand smoking is a huge thing right now. So marijuana is legalized, so kind of big issue. So maybe in 5-10 years, we probably gonna see a lot of things going on. So we have to take action now.
Yes, to the point that Daouda mentioned, I just think that it is needed more enforcement for these policies of secondhand smoking, especially in the buildings, because in my work, in my experience, I see a lot of cases where the kids live in a building, right, with their parents, but then the neighbors smoke, and then the smoke comes all the way, the windows, the door, and it is very hard to just, control that situation. So how are we enforcing these laws that are currently in place to improve really like to eliminate the triggers, that trigger at the household?
So I think one action that's so important is just partnering. And we're able to do that through NYSCHECK and the amazing work that all of the centers are doing, as well as the New York State Children's Asthma Initiative, the New York City Asthma Network. There's so many opportunities, and so much of us are doing so many things. And when we partner together, it can just be that much more powerful and impactful.
I agree with all that. Another thing I heard this morning from your presentations was building partnerships with families and communities and building trust. They need to trust us. And, what we're trying to teach students is active listening. Take some time, listen to your families, listen to what their needs are, uncover those needs, and then that's the only way we can address them. So I think that's our vision for the future, to be active listening to our families and our communities.
Thank you all. I think we have a couple minutes if there are any questions from the audience for our awardees. We're happy to take a couple of questions. Any questions? If not, they are here through lunch and the afternoon, so feel free to continue these conversations. We'll keep the program moving, but I think you all deserve a standing ovation. So I think that's what we should do next. All right, thank you so much. All this work takes a village. I think we've updated this, but all of you in the room today, we need to get your logos up here too. This community is only growing, and as Lynley said, it's the power of partnerships that take us from a hope and a prayer to real meaningful change. We want to recognize the power that exists in this room. Help us plan for next year. If you could all take a photo of this, get your cameras on here, fill out the evaluation, take a minute. This is for our colleague, Dr. Sophia Kurdumi-Penley and Chris Bland. Would love to hear your feedback on what we could do next year to celebrate Children's Environmental Health Day, or if you have ideas for things that we can start doing today together, let us know. I'll leave that up for a couple of seconds. For those of you joining us online, of which there were, I think, over 30 people online with us today as well, please do complete the evaluation as well. I'm going to move on to then, I'll give you a couple minutes to do that. Okay. The next portion is the meet and greet. These are the questions for folks to discuss in the room before we break for lunch. We'd like you to share with someone you don't know in the room, your name, your affiliation, what issue you're passionate about. What's your takeaway message from today, and one action that we can take to advance children's environmental health? And you're welcome to take these conversations out. Their lunch is actually outside and available. There are a couple of different places to have lunch. You saw the atrium outside where Starbucks is located. There are a couple of tables there. There are a couple of tables beyond that area closer to the Fifth Avenue entrance. And there's also an outdoor area with tables and seating. So the plan after lunch is to meet back here at 12:50. If you can meet at 12:50 here in this lobby where the food is, the tour leads will be meeting with you to lead you to the 3 tours that are scheduled for the afternoon. And these are really community gatherings. It's an opportunity for us to get to know each other better, hear more about the work that you're doing, and think about how we can collaborate. And so Perry Sheffield will be leading the hospital sustainability tour. Chase Moon will be leading the New York Academy of Medicine Rare Books tour. There are still spots available for that tour. I highly recommend it. It's like going to Hogwarts. So if that doesn't sell you, and it's just around the corner. So highly recommend it. And they're specifically pulling books for children's health and the environment. The Central Park Tour is open to all. I am not an expert guide, but I will walk you around my favorite parts of Central Park. There's the Central Park Conservatory Garden, the Reservoir, the Harlem Mere, the New Davis Center. I will take you wherever you want to go. So with that, we will conclude today's events with an opportunity for you all to get to know each other and for us to get to know you better too. So feel free to introduce yourself to someone you don't know in the room and answer these questions and continue those conversations through the day. Thank you all so much for being here. Thank you to Michael Agiogu, who's outside, who does so much of the logistics for getting this. Oh, and Perry's reminding me, before you walk out, we want a group picture with all of you. Cappy, do we have directions for where you want all of us? Out there. Okay, so let's head out into the lobby and take a group picture.